In this video by Deckplate, we will understand the VA disability ratings for organic diseases of the central nervous system. Brain vessel thrombosis, brain vessel hemorrhage, residuals of traumatic brain injury TBI, cerebral arteriosclerosis. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA provides specific disability ratings for organic diseases of the central nervous system. Each condition has unique rating criteria, depending on the severity of the symptoms and the impact on the veteran's ability to function. Brain vessel thrombosis. Diagnostic code 8008. Brain vessel thrombosis refers to a blood clot in the vessels of the brain, leading to a restriction of blood flow and potential damage to brain tissue. Brain vessel hemorrhage. Diagnostic code 8009. Brain vessel hemorrhage occurs when a blood vessel in the brain ruptures, leading to bleeding in or around the brain. These vascular conditions are rated at 100% for 6 months. After the 6-month period, rate based on residual effects, but a minimum of 10% is assigned. Residuals of traumatic brain injury, TBI, diagnostic code 8045. There are 3 areas of dysfunction due to TBI: cognitive, emotional or behavioral, and physical. Cognitive impairment is defined as decreased memory, concentration, attention, and executive functions such as planning, problem-solving, judgment, decision-making, etc. Cognitive impairments are evaluated under the table Evaluation of Cognitive Impairment and Other Residuals of TBI Not Otherwise Classified. Subjective symptoms can be residuals of TBI include headaches, dizziness, and other complaints that affect daily functioning. These symptoms are also evaluated under the same table, unless a distinct diagnosis, like migraine or Meniere's disease, allows for a separate evaluation under another code. Emotional or behavioral dysfunction are evaluated under the mental disorders rating under Section 4.130. If no diagnosis of a mental disorder exists, the emotional or behavioral symptoms are evaluated under the TBI table. Symptoms of physical neurological dysfunction may include motor or sensory dysfunction such as pain, visual impairments, seizures, balance issues, speech difficulties, loss of sense of smell and taste, hearing loss, neurogenic bladder, endocrine dysfunctions, nerve dysfunctions, etc. These dysfunctions are rated under appropriate diagnostic codes for specific neurological conditions. The preceding list of types of physical dysfunction does not encompass all possible residuals of TBI. For residuals not listed here that are reported on an examination, evaluate under the most appropriate diagnostic code. The VA considers special monthly compensation for significant impairments such as loss of use of an extremity, sensory impairments, erectile dysfunction, or the need for aid in attendance. Cerebral arteriosclerosis. Diagnostic code 8046. Cerebral arteriosclerosis involves the hardening or narrowing of brain arteries, leading to restricted blood flow. Disabilities such as hemiplegia, cranial nerve paralysis, and other neurological impairments caused by cerebral arteriosclerosis are rated under the specific codes for those conditions. Subjective complaints like headaches, dizziness, tinnitus, insomnia, and irritability, if linked to cerebral arteriosclerosis, are rated at 10% and no more under diagnostic code 9305. Ratings above 10% for cerebral arteriosclerosis are not given unless there is a diagnosis of multi-infarct dementia. Note: the ratings under code 8046 apply only when the diagnosis of cerebral arteriosclerosis is substantiated by the entire clinical picture and not solely on findings of retinal arteriosclerosis. Thank you for watching this video. Please don't forget to subscribe and like our videos.